LMSW Practice Test Questions and Answers 2026. Flashcard 1. 1. According to Beck, a depressed person does not see the positive aspects of his or her situation because of A. Precipitating factors, B. Lack of support, C. A dysfunctional schema, D. Lack of adaptive coping strategies. Think of the answer before the reveal. The answer is C. A dysfunctional schema. Flashcard 2. 2. It is necessary to obtain informed consent prior to giving out data about a patient. Which of the following statements is most correct regarding this issue? A. You must obtain informed consent from your patient in most situations, but not in all situations. B. If a significant other requests information about your patient, you may release it without informed consent. C. If you are going to consult with a colleague, you must have informed consent from your patient. D. You must always have informed consent from your patient. Think of the answer before the reveal. The answer is A. You must obtain informed consent from your patient in most situations, but not in all situations. Flashcard 3. 3. A soldier with combat-related post-traumatic stress disorder desires to return to combat. What is the first thing you should do? A. Allow the soldier full self-determination, returning when he deems appropriate. B. Inform the client that return will likely cause an increase in symptoms and does not advise. C. Contact the commanding officer to determine if this is an option for the soldier. D. Assess progress in treatment and current level of functioning. Think of the answer before the reveal. The answer is D. Assess progress in treatment and current level of functioning. Flashcard 4. 4. A man is referred by his primary care provider and presents with a diagnosis of hypochondriasis. What is the first crucial step in treatment? A. History taking. B. Establishment of trust and appreciation for the patient's problems. C. Education about the link between stress, emotions, and lifestyle and physical health. D. Treatment planning. Think of the answer before the reveal. The answer is B. Establishment of trust and appreciation for the patient's problems. Flashcard 5. 5. Client, I'm depressed. I've lost my hair at a much quicker rate than I thought possible. I'm terribly embarrassed to go out in public. I'm feeling extremely anxious and uneasy about my baldness. Social worker, you're anxious and uneasy about the transformations that are a natural process of aging. The social worker's response is A. Encouragement. B. Summarization. C. Paraphrase. D. Reflection of feeling. Think of the answer before the reveal. The answer is D. Reflection of feeling. Flashcard 6. 6. How do you find the median of a set with an even number of items? A. The larger of the two middle numbers is the median. B. The two middle numbers are both medians. C. Find the average of the two middle numbers. D. A set with an even number of items does not have a median. Think of the answer before the reveal. The answer is C. Find the average of the two middle numbers. Flashcard 7. 7. A young, beginning social worker has some interpersonal and interpersonal struggles with women in authority positions that stem from her poor relationship with her mother. The social worker's client is a female 50-ish successful CEO of an internet startup. The social worker is likely to struggle in therapy due to A. Counter-resistance, B. Countertransference, C. Transference, D. Resistance. Think of the answer before the reveal. The answer is B. Countertransference. Flashcard 8. 8. When treating elder adults with depression, the best approach to treatment is A. Cognitive behavioral therapy coupled with family interventions, B. Significant reliance on psychiatry because medication management is most important, C. Treatment of elder adults is similar to other adults, so no significant alterations are needed, D. Coordination between medical and mental health due to the influence of medical conditions on psychiatric symptomatology. Think of the answer before the reveal. The answer is D. Coordination between medical and mental health due to the influence of medical conditions on psychiatric symptomatology. Flashcard 9. 9. Professional ethics and professional values differ in which of the following? A. Values are a subset of ethics. B. Values deal with what is right or wrong in practice, and ethics deals with the principles of practice. C. Values and ethics are basically the same and are evaluated based on the specific situation. D. When a social worker makes a judgment that is ethical, you can assume it is a judgment that also upholds professional values. Think of the answer before the reveal. The answer is B. Values deal with what is right or wrong in practice, and ethics deals with the principles of practice. Flashcard 10. 10. What is the first thing to assess in on-site basic crisis intervention, such as in the aftermath of a natural disaster? A. Immediate needs for physical safety, food and clothing. B. Trauma response. C. Future mental health risk. D. Needs for various concrete services, for example transportation, alternate housing. Think of the answer before the reveal. The answer is A. Immediate needs for physical safety, food and clothing. Flashcard 11. 7-year-old child is refusing to sleep in his own bed at night. When the parents sit with him in his room, he is fine. When they leave the room, he begins to cry. When they come back in, he stops crying. This is an example of operant conditioning, classical conditioning, punishment cycles, higher order conditioning. Think of the answer before the reveal. The answer is operant conditioning. Flashcard 12. Older individuals are often misdiagnosed with Alzheimer's 1. In fact, the more accurate diagnosis is anxiety, depression, thyroid disorder, delirium. Think of the answer before the reveal. The answer is depression. Approximately 55% of the elderly suffer from depression and are often misdiagnosed with Alzheimer's or dementia. Anxiety answer #1 is not correct. Although anxiety can be a problem in older adults, anxiety is not a characteristic that would be a symptom of Alzheimer's. Thyroid disorder answer #3 is not correct because this condition is a malfunction of the thyroid gland, resulting in a variety of medical symptoms, usually not similar to symptoms of Alzheimer's. Delirium answer #4 is not correct, as delirium is characterized by a disturbance of consciousness and a change in cognition that develop over a short period of time. Flashcard 13. A social worker is seeing a new client, who is a college student, for therapy. After speaking with the client about her current enrollment at the university, the social worker spent a significant amount of time urging the client to work less so she could focus on school. The social worker wants the client to get all grades this semester because she reminds him of his daughter at that same stage in life, as well as the anxieties that he experienced during that time in his life. The client really wants to please the social worker because he reminds her of her dad. Which of the following is reflected in the client? Transference, countertransference, projection, a dual relationship. Think of the answer before the reveal. The answer is transference. In a therapeutic context, transference refers to redirection of a client's feelings from a significant person to the social worker. Countertransference, answer #2 is incorrect because this is the redirection of a social worker's feelings toward a client, or more generally speaking, a social worker's emotional entanglement with a client, which was reflected in the first part of the question. However, this does not describe what is being reflected in this client. Projection, answer #3 is demonstrated when a person's own unacceptable or threatening feelings are repressed and then attributed to someone else, which is not occurring in this case example. A dual relationship, answer #4 is incorrect, as this refers to a situation where multiple roles exist not just perceived between a social worker and a client, such as an actual father and daughter relationship between a social worker and client. Flashcard 14. A client was recently diagnosed with multiple sclerosis. She immediately began to learn everything she could about the illness, reading books, journal articles, and the latest experimental research. The client's response to her diagnosis is representative of which defense mechanism? Intellectualization, regression, sublimation, repression. Think of the answer before the reveal. The answer is intellectualization. Flashcard 15. A social worker has been working with a 35-year-old divorced woman who has joint custody of her son, but is the custodial parent. Her ex-husband, whom the social worker has never met, is taking the client to court in an attempt to gain full custody of the son. The social worker receives a subpoena from the husband's attorney requesting records regarding the wife's therapy sessions with the social worker. The social worker is required to do which of the following? The social worker must release the entire record of the therapy sessions to the attorney. The social worker is allowed to release only those records that make direct reference to the wife's relationship with the son, not her treatment issues. The social worker is required to respond to the subpoena, but is not required to release records since the subpoena was issued by the attorney and not a judge. The social worker does not have to respond to the subpoena because the client's records are confidential. Think of the answer before the reveal. The answer is the social worker is required to respond to the subpoena, but is not required to release records since the subpoena was issued by the attorney and not a judge. Flashcard 16. A 22-year-old female client is considering having an abortion. Her social worker is pro-choice and feels passionately about the issue. Which of the following is the first thing that the social worker should do in this situation? She should talk with the client about abortion alternatives. She should refer the client to another social worker. She should help the client obtain the services she needs to get an abortion. She should ask the client to share her rationale for choosing abortion. Think of the answer before the reveal. The answer is the correct answer is #4. She should ask the client to share her rationale for choosing abortion. Keep in mind that a social worker should always seek to understand. Talking with the client about abortion alternatives, answer #1, and referring the client to another social worker, answer #2 are both not correct because once the client has provided more information, The social worker can ascertain if the client lacks information about other options or needs to be referred to another social worker. Helping the client obtain the services she needs to get an abortion. Answer #3 is not correct, because if the social worker helps the client obtain abortion services, she may miss an important opportunity to gain further understanding of the client's circumstances and alternatives. Remember, the question asks for the first thing the social worker should do in this situation. Flashcard 17. A teacher has noticed some dramatic behavioral changes in a 7-year-old boy over the recent weeks and has referred him to the school social worker. The child appears distracted in class, no longer finishes his daily assignments, has become aggressive toward peers, has soiled his pants on 2 occasions, and appears apprehensive around adults. Which of the following might likely be the cause of this child's behaviors? Possible neglect at home, possible sexual abuse, onset of conduct disorder, recent death of a loved one. Think of the answer before the reveal. The answer is possible sexual abuse. Flashcard 18. A 30-year-old gay male is seeking treatment in a mental health agency. The intake social worker begins to gather information to determine this individual's qualification for services. The client states that he has been feeling sad and hopeless and is losing interest in activities in which he used to participate. He states that he and his partner have recently broken up and that he has been spending less time with his parents and siblings. The intake worker should refer this individual for treatment and identify his presenting problem as his homosexuality, relationship issues, family issues, depression. Think of the answer before the reveal. The answer is depression. Flashcard 19. A client asks the social worker to view his therapy records. The social worker knows that showing the records to the client will be harmful given the client's profile. What is the social worker's ethical responsibility? The social worker should show the client his or her records, as the client has the right to view them. The social worker should limit the client's access to his records and provide assistance in interpreting the records shown to the client. The social worker should deny the client access and explain the reasons for doing so. The social worker should consult with a colleague. Think of the answer before the reveal. The answer is the social worker should limit the client's access to his records and provide assistance in interpreting the records shown to the client. Flashcard 20. A politician recently admitted his arrangement with the pharmaceutical industry, which involved writing key legislation to mandate vaccinations if the industry would, in return, finance the majority of his re-election campaign. According to Kohlberg's theory of moral development, at which level of moral development was the politician operating? Pre-conventional morality, conventional morality, post-conventional morality, morality of social contract. Think of the answer before the reveal. The answer is the correct answer is #1 pre-conventional morality. Pre-conventional morality is level 1, stage 2, and involves you scratch my back and I'll scratch your back types of behavior. Conventional morality, answer #2, and post-conventional morality, answer #3, are both incorrect, as they are both identified as levels involving moral reasoning that goes beyond a self-focused perspective. Morality of social contract, answer #4, is not correct because it is a stage, not a level, according to Kohlberg. Moreover, it involves higher moral reasoning than that demonstrated by the politician. Flashcard 21. A client has been drinking frequently since the death of his son last year. He states that he feels better physically when he drinks more, especially in the mid-morning, and that he does not feel intoxicated as often as he did immediately after his son's death. He expresses his desire to quit, but says that he cannot get away from the craving. The client feels embarrassed because his sister found him unconscious one night as a result of his drinking. Which of the following would most likely be the social worker's first diagnosis? Depression, alcohol dependence, alcohol abuse, avoidant personality disorder. Think of the answer before the reveal. The answer is alcohol dependence. Depression answer #1 is not correct because while the client may be depressed, more data would be needed to make this diagnosis. Alcohol abuse answer #3 is not correct because the client would need to show at least 2 physiological factors and 5 behavioral patterns over a 12-month period, which is severe and exceeds the requirements for alcohol abuse. Avoidant personality disorder answer #4 is not correct because this question does not provide sufficient information to determine this diagnosis. Flashcard 22. A social worker has recently learned from the wife of a couple he is seeing that the wife believes that she is a lesbian. She states she does not want to share this with her husband. During the next session, the husband asks his wife if she likes women better than men. The wife answers no. What is the first response that the social worker should make in this situation? Encourage the wife to be honest. Encourage the husband to ask the wife after the session. Say nothing, but plan on speaking with the wife after the session. Encourage the couple to discuss the issue. Think of the answer before the reveal. The answer is encourage the couple to discuss the issue. The responsibility for establishing a relationship of honesty rests with the couple. The social worker can facilitate the process of developing such a relationship by encouraging dialogue about this and other important issues. Encouraging the wife to be honest answer #1 is not the best answer for this scenario, as the social worker would be indicating that he has information that the husband does not have. The social worker may, at another time, need to help the wife decide how she will handle this information with her husband. Encouraging the husband to ask the wife after the session answer #2 and saying nothing, but planning on speaking with the wife after the session answer #3 are both incorrect answers because these would be interfering with the couple dealing with their own situation. Flashcard 23. A social worker receives a new client who is seeking cognitive behavioral therapy, which is not the social worker's treatment of expertise. The social worker should attempt this intervention, refer the client to an expert, explore the client's reasons for wanting cognitive behavioral therapy, use his own technique, says he or she is well trained to meet the client's needs. Think of the answer before the reveal. The answer is explore the client's reasons for wanting cognitive behavioral therapy. As the social worker discusses this with the client, it may become evident that the social worker is able to provide the services the client desires. Alternatively, the discussion may reveal the need to refer the client elsewhere. Attempting this intervention answer #1 is not correct because a social worker should be trained and competent in the interventions he or she uses. Referring the client to an expert answer #2 is not the best answer because the social worker should find out more about the client's request before referring the client to an expert in cognitive behavioral therapy. Using the social worker's own technique says he or she is well trained to meet the client's needs answer #4 is not correct because the client has asked specifically for cognitive behavioral therapy and should be part of the decision-making process regarding whether other techniques could be as beneficial. Flashcard 24. A 60-year-old female client has been meeting with a social worker to discuss dissatisfaction in her marriage. Over the course of the first few sessions, The social worker noticed that the client spent little time discussing substantive marital issues and instead discussed her accomplishments, even when it did not fit into the conversation. She also talked about how she felt that it was important for her to spend her time with other well-educated individuals. The client described work situations in which she became angry and then tearful when not validated for her achievements. She also tried to get a manager fired for not implementing her ideas. The most likely diagnosis for this client would fall into which category? Cluster A, Cluster B, Cluster C, none of the above. Think of the answer before the reveal. The answer is narcissistic personality disorder. A Cluster B classification is characterized by many of the behaviors the client exhibits. Cluster B personality disorders are evidenced by dramatic, erratic behaviors and include histrionic, narcissistic, antisocial, and borderline personality disorders. Cluster A personality disorders answer #1 is not correct because those disorders are considered to be marked by odd, eccentric behavior and can result in diagnoses such as paranoid, schizoid, and schizotypal personality disorders. Cluster C personality disorders answer #3 is not correct because those disorders are distinguished by the anxious, fearful behavior commonly seen in obsessive-compulsive, avoidant, and dependent personality disorders. Flashcard 25. A social worker is interested in conducting a study of drug use among adults of different ethnic backgrounds. Which of the following sampling strategies is most apt to yield a sample that reflects the ethnic composition of the area? Simple random sampling, convenience sampling, snowball sampling, stratified sampling. Think of the answer before the reveal. The answer is stratified sampling. This form of sampling is used to ensure that there are sufficient cases representing different values of a variable, in this case ethnic groups. Simple random sampling answer #1 is not correct because simple random sampling refers to the random selection of a predetermined number of cases from a sampling frame, where each case in the sampling frame has an equal probability of being selected for inclusion in the sample. Convenience sampling answer #2 is not correct because convenience sampling refers to cases that are selected for inclusion in a study sample because they can be readily accessed by the researcher. Snowball sampling answer #3 is not correct because snowball sampling is a sampling strategy that involves compiling the sample as the study progresses. Flashcard 26. A 65-year-old Hispanic-looking woman walks into a clinic for her first therapy session. The social worker is a bilingual therapist. Under these circumstances, what is the first thing that the social worker should do? Greet the woman in Spanish to let her know that the social worker is respectful of her culture. Ask the woman if she would like to speak to the social worker in Spanish. Consult with the state to see if English is the official language and inquire about related laws. Greet the woman in English. Think of the answer before the reveal. The answer is greet the woman in English. Flashcard 27. When writing about the duality of the Black experience and the dual perspective, Leon Chesting identified two systems. Which of the following is the larger, more dominant system that provides instrumental and pragmatic needs for physical survival and quality of life? The structural system, the nurturing system, the sustaining system, the system of basic needs. Think of the answer before the reveal. The answer is the sustaining system. Leon Chesting identified two systems, the nurturing system and the sustaining system. The sustaining system is the larger, more dominant system that provides instrumental and pragmatic needs for physical survival and quality of life, such as political power, shelter, and employment. The nurturing system answer #2 is an incorrect answer to this question, as it relates to the person's immediate family and community environment. The other two answer choices, answers #1 and #4, are incorrect, as they are not real terms related to the information provided in the question. Flashcard 28. A social worker has completed an assessment of a client and is in the process of recommending a placement for a client's treatment. Which of the following is the first consideration in selecting a treatment approach for the client? The nature of the client's problem, the level of care needed, the treatment provider's knowledge and skill level, the philosophy of the agency. Think of the answer before the reveal. The answer is the level of care needed. While all of the other answer options, the nature of the client's problem, answer #1, the treatment provider's knowledge and skill level, answer #3, and the philosophy of the agency, answer #4, are important, the level of care needed must be the first consideration. If the client needs hospitalization, incarceration, home healthcare, or hospice, the treatment options would be much different than if the client can receive services on an outpatient basis. Flashcard 29. A 40-year-old male client explains that he is seeking care because he suffers from panic attacks. He notes that he gets chills, nausea, dizziness, and experiences fear about once a day. A social worker's first step with this client would be to teach relaxation therapy, set goals for reduction of anxiety, arrange for a doctor's appointment, assess the client's current situation. Think of the answer before the reveal. The answer is assess the client's current situation. Flashcard 30. In a task-centered treatment approach, once a social worker establishes the client's needs, which of the following is the best option? As the expert, the social worker should be the primary person to establish the treatment goals. The client should be the primary person to establish the treatment goals. The client and the social worker should jointly establish the treatment goals. A medical doctor should be included in establishing the treatment goals. Think of the answer before the reveal. The answer is the client and the social worker should jointly establish the treatment goals. Flashcard 31. You are called to evaluate a 64-year-old male with chronic obstructive pulmonary disease. He lives in an assisted living facility and was brought to the emergency room by his daughter. She had taken him to lunch and became distressed when he refused to return to the facility. He states he wants to live in his motor home, as he resents the loss of privacy at the facility. His daughter confirms he owns a working, fully self-contained motor home, i.e. stove, shower, refrigerator, etc. He has adequate funds. He plans to park the motor home in a nearby Campgrounds of America (KOA) campground, where all utilities can be hooked up. He can have food and other supplies delivered. However, it is November and it is unseasonably cold. The doctor confirms that the patient is prone to pneumonia, and the daughter states he will die if he doesn't return to the facility. The patient refuses to consider any other living situation. In this situation, the social worker should A. Call the police and have them take the patient back to the facility. B. Call Adult Protective Services for further intervention. C. Allow the patient to move into his motor home. D. Place the patient on an involuntary hold for suicidal behavior. Think of the answer before the reveal. The answer is C. Allow the patient to move into his motor home. The patient has a plan sufficient to meet his needs for food, clothing, and shelter. He has the legal right to choose where he wishes to live, even if others are not comfortable with his choice. Calling the police will not help, as they cannot force him to return to the facility. Adult protective services may have a subsequent role if the patient begins to exhibit marked self-neglect or cognitive changes, but they cannot force the patient either. Finally, the patient is not eligible for an involuntary hold, as he is not placing himself or others in danger based upon a diagnosable mental illness, intoxication, or other substance abuse. Careful collateral planning, however, will be important, ensuring the daughter visits and checks in on him, etc., to try and maximize his potential for success. After coping with the hardships of independent living, he may willingly return to assisted living. Flashcard 32. 2. You have just had your first session with a 24-year-old college student. She is seeing you following the breakup of a 2-year relationship, which occurred without warning about 6 weeks prior to this visit. As she explained it, he met someone else and just moved on. She has been having trouble sleeping and concentrating on her studies since that time. Today she presents as dysphoric and tearful, but is effectively expressive and responsive to humor and other interactive stimuli. The university she attends is a considerable distance from her family and friends, leaving her with limited support during this difficult time. The most appropriate diagnosis would be A. Primary insomnia. B. Major depression. C. Adjustment disorder with depressed mood. D. Acute stress disorder. Think of the answer before the reveal. The answer is 2C. Adjustment disorder with depressed mood. Criteria for this disorder includes a time-limited nature, usually beginning within 3 months of the stressful event, and lessening within 6 months either with removal of the stressor or through new adaptation skills. Adjustment disorder is a subthreshold disorder, allowing for early classification of a temporary condition when the clinical picture remains vague. While the patient does have insomnia, it arises from the stressful loss and not as an independent condition. Many of the essential criteria for a major depression are absent weight loss, psychomotor agitation, blunted affect, etc., although without successful treatment this condition could emerge. The diagnosis of acute stress disorder is not appropriate, as the precipitating event did not involve threatened or actual serious injury or death. Flashcard 33. Free. You are hired by a private practice therapist who operates a court-supervised violent offender treatment program. One of your responsibilities is to screen new client referrals to ensure that only low-risk, first-time offenders are accepted into the program. In this process, you are to have each client sign a treatment consent form, which also includes a detailed consent for release of information. You note that instead of the usual time and target limits, the form allows information to be released at any time to any law enforcement agency, any spouse, ex-spouse, or significant other, any welfare or abuse protection agency, etc. You ask about the ethics of having clients sign this form, and you are told it's a hassle to try and get specific information releases, and the safety of the public is at stake. Use the form. Your best response is to A. Use the form as directed. B. Refuse to use the form. C. Call your licensing board and discuss the form. D. Call law enforcement and discuss the form. Think of the answer before the reveal. The answer is B. Refuse to use the form. No client or client population is beneath the ethical standards of the field. An appropriate information release form stipulates a limited period of time beyond which the form expires, the specific kind of information to be released, the specific purpose for which the information is to be provided, and a specific individual or entity to whom/which the information will be provided. While obtaining an information release is indeed a hassle, it is the ethical standard of care in the field, and deviation from it can open a practitioner to legal liability. The fact that a given client, or client population may be unaware of this does not excuse the therapist from using an ethically appropriate form in keeping with expected standards of care. Any limitations to confidentiality, such as mandatory reporting if a client expresses intent to commit a crime or harm another, belong on a treatment consent form rather than on an information release form. Flashcard 34. 4. In statistical research, a type I error, also called an alpha error or a false positive, refers to a. Failing to reject the null hypothesis when the null hypothesis is false, b. A failure to randomize research participants, thereby potentially introducing bias, c. Rejecting the null hypothesis when the null hypothesis is true, d. Assuming a normal statistical distribution when it is skewed. Think of the answer before the reveal. The answer is C. Rejecting the null hypothesis when the null hypothesis is true. A failure to randomize research participants will potentially introduce bias and may provide grounds upon which to invalidate a study, but it is not a type I error. Assuming a normal statistical distribution when it is skewed will violate the assumptions necessary to apply a proper statistical model to the analysis of data. Flashcard 35. 5. Identify the missing step in Albert R. Roberts' 7-stage crisis intervention model. 1. Assess lethality. 2. Establish rapport. 3. Blank. 4. Deal with feelings. 5. Explore alternatives. 6. Develop an action plan. 7. Follow up. The third step is A. Evaluate resources. B. Identify problems. C. Environmental control. D. Collateral contacts. Think of the answer before the reveal. The answer is B. Identify problems is the third step in the Roberts crisis intervention model. Flashcard 36. 6. Self-psychology, as postulated by Heinz Kohut, acknowledges that personality is partly formed by social structure. A cohesive self is achieved by incorporating the perceptions and functions of healthy significant others and objects into an internalized self-structure through a process called A. Empathic mirroring. B. Rapprochement. C. Differentiation. D. Transmuting internalization. Think of the answer before the reveal. The answer is D. Transmuting internalization. Empathic mirroring is the process by which the mother demonstrates reflex care and understanding of the child, in turn helping the child to develop a self-identity. Rapprochement is a term from object relations theory, indicating the need for an infant to seek independence while still retaining security. Differentiation is a substage in object relations theory, where an infant begins to look at the outside world, as opposed to the inward focus common to infants younger than 5 months of age. Flashcard 37. 7. An early cognitive theorist, who worked directly with Freud, established a theoretical orientation that differed from Freud's in 3 key features. 1. An individual's personality is best perceived as a whole, rather than as having hierarchical segments or parts. 2. Social relationships drive behavior more than sexual motivations. And 3. Current beliefs and thoughts play a far greater role in human behavior than is suggested via psychoanalytic theory, which is based largely in the unconscious and in past experiences and beliefs. The name of this theorist is A. Lawrence Kohlberg. B. Anna Freud. C. Albert Ellis. D. Alfred Adler. Think of the answer before the reveal. The answer is D. Alfred Adler. Adlerian theory also includes a biological view, largely absent in psychoanalytic theory, recognizing that hormonal changes, physical illness, chemical imbalances, and neurological disorders can dramatically influence capacity and behavior. It is important to note, however, that Alder still locates false beliefs, irrational thoughts, and misconceptions in the unconscious mind. Flashcard 38. 8. In working with a client, you become aware that she persistently behaves in ways to please or gain the approval of others. While this is not always problematic, you discover that she is obsessed with wearing the right clothes, living in the right neighborhood, and marrying the right person. At present, her finances are in a shambles as she tries desperately to keep up with the Joneses, and her romantic life is suffering as she only pursues relations that she believes others think are optimum, rather than judging relationships on more personally relevant values, such as her feelings for them, baseline compatibility, etc. Utilizing Kohlberg's theory of moral development, specify the level and stage of moral development that applies to this individual. A. Conventional level, stage 3B. Pre-conventional level, stage 1C. Post-conventional level, stage 6D. Conventional level, stage 4. Think of the answer before the reveal. The answer is A. Conventional level, stage 3. The theory of moral development was created by Lawrence Kohlberg to extend and enhance Jean Piaget's theory. Overall, Kohlberg felt that the process of moral development was more complex and extended than that put forth by Piaget. Flashcard 39. 9. You have been contacted by a couple to assist them with issues of marital discord. They have been married about 6 months. The wife presents as vulnerable, tearful, and anxious, and the husband presents as angry and overwhelmed. The wife openly claims that he has never loved me, and expresses anger that he married her without the proper feelings. The husband responds that he has done everything possible to prove his love to the point of near bankruptcy and jeopardizing his employment with frequent absences, but nothing is sufficient. During the interview, you discover that she has had many short-term relationships in the past, that she has a history of suicide gestures and fits of rage. Further, she frequently demands a divorce and then begs him to stay, is routinely physically assaultive, etc. The most likely diagnosis is A. Intermittent explosive disorder, B. Histrionic personality disorder, C. Paranoid personality disorder, D. Borderline personality disorder. Think of the answer before the reveal. The answer is D. Borderline personality disorder. Individuals with this diagnosis will exhibit frantic efforts to avoid real or imagined abandonment, unstable and intense interpersonal relationships, especially extremes of idealization and devaluation, an unstable sense of self, extreme impulsivity, for example spending, sex, drug use, reckless driving, binge eating, etc., recurring suicidal behavior, gestures or threats, or self-mutilating behavior, affective instability due to reactivity of mood, chronic feelings of emptiness, intense anger, for example frequent displays of temper, recurrent physical fights, transient, stress-related paranoid ideation, or severe dissociative symptoms. However, as with all Axis Roman II disorders, this diagnosis cannot properly be made during a first contact, but must be substantiated over a course of clinical contacts sufficient to compel the diagnosis to be made DSM Roman IV. Flashcard 40. 10. All but one of the following are National Association of Social Workers NASWA standards for cultural competence. A. Social workers should endeavor to seek out, employ, and retain employees who provide diversity in the profession. B. Social workers shall endeavor to resources and services in the native language of those they serve, including the use of translated materials and interpreters. C. Social workers should develop the skills to work with clients in culturally competent ways and with respect for diversity. D. Social workers should work with diverse clients only if they have had specific training in that client's unique cultural background. Think of the answer before the reveal. The answer is D. Although it is ideal for social workers to receive specific training regarding each of the individual minority populations they typically serve, they should still ensure that someone from an unfamiliar background receives needed services even where no staff with special training in that background is available. Flashcard 41. 11. The Diagnostic and Statistical Manual of Mental Disorders DSM, in its current version the DSM Roman 4TR, is used to diagnose mental disorders. It also allows for the entry of related factors through a multi-axial coding approach. Name the proper axis in the corresponding order for entry of each of the following. A. The global assessment of functioning. B. Relevant physical disorders. C. Personality disorders and mental retardation. D. Relevant psychosocial factors. And E. Clinical disorders. A. Axis I. Axis Roman 3. Axis Roman 2. Axis Roman 4. And Axis VB. Axis V. Axis Roman 3. Axis Roman 2. Axis Roman 4. And Axis IC. Axis Roman 2. Axis Roman 4. Axis Roman 3. Axis V. And Axis ID. Axis Roman 4. Axis Roman 3. Axis Roman 2. Axis V. And Axis I. Think of the answer before the reveal. The answer is B. Axis V. Axis Roman 3. Axis Roman 2. Axis Roman 4. And Axis I. Clinicians should assess clients on all 5 axes to ensure a thorough evaluation. Flashcard 42. 12. You are seeing a 16-year-old youth who has, for the past year, been losing his temper frequently, is regularly argumentative with adults, often refuses to follow direct requests, is easily annoyed, and routinely uses blaming to escape responsibility. Approximately 4 months ago, he was caught in a single episode of shoplifting. The most appropriate diagnosis for this youth is A. Oppositional defiant disorder. B. Conduct disorder. C. Impulse control disorder. D. Disruptive behavior disorder, not otherwise specified. Think of the answer before the reveal. The answer is A. Oppositional defiant disorder. Disruptive behavior disorder, not otherwise specified. NOS is an umbrella term for behavior disturbances that lack sufficient clarity for the assignment of a more specific diagnosis. Impulse control disorder is only appropriate when a behavior is compulsive in nature. While anger may be a part of that picture, it tends to be an overreaction to a provocation. Other relevant compulsions include gambling, skin picking, kleptomania, etc. The hallmark of conduct disorder is deliberate cruelty and wanton disregard for others' rights and property. This client lacks any pervasive and long-standing evidence in this regard. Flashcard 43. 13. Encopresis is defined as A. The voluntary or involuntary passage of stool in an inappropriate place by a child over the age of 4. B. The voluntary or involuntary passage of stool in an inappropriate place by a competent adult. C. Deliberate fecal incontinence only in a child over age 4. D. Involuntary fecal incontinence only in a developmentally delayed adult. Think of the answer before the reveal. The answer is A. The voluntary or involuntary passage of stool in an inappropriate place by a child over the age of 4, i.e. past toilet training. This is a frequently misused term. It is most frequently applied to children and developmentally delayed adults. Adults with psychosis may warrant use of the term, although the term fecal incontinence is more commonly used for adults. A British literature review found only one use of the term in an adult that was not either psychotic or mentally retarded. A 1932 case of a 36-year-old diagnosed with infantile neurosis. The most typical etiology is stool impaction, constipation compromising sphincter control and allowing leakage into the underclothing. However, emotional disorders, anxiety, or oppositional defiant disorder can sometimes underlie the behavior. Incidence of the condition drops steadily after age 6. Flashcard 44. 14. The following criteria are all used to distinguish substance abuse from substance dependence except A. Symptoms of substance abuse are usually less severe than those of dependence. B. The problematic effects of abuse are usually limited to family, finances, employment, and legal issues, for example driving under the influence, while dependence also involves significant physiological problems. C. Substance abuse typically involves narcotics, while dependence typically involves non-narcotic drugs. D. Abuse is typically limited to recreational use, while dependence involves the need for increasing doses for the desired effect and withdrawal symptoms if not used regularly. Think of the answer before the reveal. The answer is C. Substance abuse typically involves narcotics, while dependence typically involves non-narcotic drugs. In general, narcotics are more addictive than non-narcotic substances. Even relatively benign substances of abuse, such as marijuana, can produce dependence if used often enough, and mounting clinical and preclinical evidence suggests that a marijuana withdrawal syndrome also exists. However, it is not yet in the DSM. Common treatment medications include antabuse disulfiram for alcohol abuse, Revia naltrexone for alcohol and narcotics, and Trexin naltrexone for alcohol and opioid dependence. Flashcard 45. 15. Name the 4 classic diagnostic A's of schizophrenia. A. Awareness, ambivalence, autism, and associations. B. Agitation, awareness, associations, and autism. C. Affect, anxiety, ambivalence, and awareness. D. Affect, associations, ambivalence, and autism. Think of the answer before the reveal. The answer is D. Affect, associations, ambivalence, and autism. In 1911, Eugen Bleuler coined the term schizophrenia and defined it using his now classic 4 as affect blunted emotional response to stimuli, associations loosening, disordered thought patterns, ambivalence and inability to make decisions due to poor information integration and processing, and autism a preoccupation with the self and one's thoughts. Common medications for treatment: chlorazole clozapine, Haldol halopridol, L'Occitane loxapine, Melaril thiobridazine, Prolixin flufenazine, Risperdal risperidone, Stelazine trifluoprazine, Forazine chloropromazine, and Zyprexa olanzapine. Flashcard 46. 16. You are called to see a young black man in his mid-20s. 2 adult sisters brought him for an urgent appointment. The young man is clean, neatly dressed in slacks, dress shoes, and a tweed sport coat. He is also calm, relaxed, and without any signs of agitation. The two sisters, however, appear disheveled, frazzled, and almost histrionic. They blurt out that he has problems and urge you to talk with him. Privately, he tells you that he is fine. Later, however, the ladies tell you he left home abruptly and traveled cross-country with no destination. He didn't sleep for 3 days with them pursuing him, was spending money excessively and writing checks he couldn't cover. He ended up in a nationally famous amusement park at 3 p.m., having scaled a fence, sitting on an empty roller coaster waiting for the ride to start. When confronted, he admits all of this, but says he's now rested and doing better. The most likely diagnosis would be A. Brief psychotic disorder. B. Bipolar. I. Single manic episode in full remission. C. Bipolar. I. Single hypomanic episode in full remission. D. Cyclothymic disorder. Think of the answer before the reveal. The answer is B. Bipolar. I. Single manic episode in full remission. There is no evidence of frank psychosis, thus brief psychotic disorder can be ruled out. Hypomania does not appear appropriate, as the client's behavior would likely have resulted in hospitalization had anyone been able to evaluate him during his period of mania. Cyclothymic disorder does not appear appropriate, as the client's conduct exceeded the threshold severity for hypomania, and no information is provided regarding depressive symptoms, though he may well have them. Finally, the bipolar. I. Single manic episode is identified to be in full remission, as the client's manic symptoms appear to have completely resolved. Flashcard 47. 17. A therapeutic approach that views the client from a social context that sees behavior as derived from unconscious drives and motivations, that views disorders and dysfunction as emerging from internal conflicts and anxiety, and that seeks to facilitate the conscious awareness of previously repressed information is called A. Cognitive approach. B. Psychoanalytic approach. C. Gestalt approach. D. Behavior approach. Think of the answer before the reveal. The answer is B. Psychoanalytic approach. This approach is built upon the concepts and theory of Sigmund Freud and others who have followed him. The approach is also sometimes called a psychodynamic approach. Flashcard 48. 18. The concepts of pre-affiliation, becoming acquainted, power and control, setting the roles, intimacy, developing cohesion, differentiation, independent opinion expression, and separation, moving to closure and termination are all stages in A. The life cycle of a therapeutic relationship. B. General relationship cycles. C. Group development. D. Team cohesion. Think of the answer before the reveal. The answer is C. Group development. During these stages, the social worker needs to 1. Facilitate familiarity and elicit participation. 2. Clarify roles. 3. Develop group cohesion. 4. Support individual differences. And 5. Foster independence. The use of a sociogram, a chart or diagram depicting group member relationships, can aid the social worker in revealing, monitoring, and intervening if necessary in group member interactions and bonding. Flashcard 49. 19. When a client seems overwhelmed or uncertain how to share further, it can help to break down the concerns at hand into smaller, more manageable parts. This communication technique is known as A. Fragmentation. B. Sequestration. C. Downsizing. D. Partialization. Think of the answer before the reveal. The answer is D. Partialization. For example, well, if we take these things one at a time, maybe we can start with flashcard 50. 20. Single system research designs involve observing one client or system only n equals 1 before, during, and after an intervention. Because of their flexibility and capacity to measure change over time, single system designs are frequently used by practitioners to evaluate A. Their practice. B. Difficult client. C. Conformation to policy. D. Regulation adherence. Think of the answer before the reveal. The answer is A. Their practice. The evaluation process involves 1. Problem identification called the target of the research. 2. Operationalization selecting indices that represent the problem that can be measured. 3. Determining the phase, the time over which measurement will occur, including a baseline phase without intervention and an intervention phase. This may also include a time series design, where data is collected at discrete intervals over the course of the study. Flashcard 51. 1. A 15-year-old girl has been sent home from school on 3 occasions for drinking alcohol at school. Each time, the mother becomes angry and threatens to punish the girl, but is convinced by the father to give her another chance. Which of the following best characterizes the father's behavior in this situation? A. Triangulation. B. Enabling. C. Advocating. D. Manipulating. Think of the answer before the reveal. The answer is B. Enabling. Flashcard 52. 2. Parents continually refuse to communicate with their child who is in a residential treatment facility. The social worker should first A. Respect the parent's need for separation by not contacting them. B. Request that the child be discharged. C. Contact the parents about the child's placement. D. Assess the child's response to the parent's actions. Think of the answer before the reveal. The answer is D. Assess the child's response to the parent's actions. Flashcard 53. 3. Common indicators of sexual, physical, and emotional abuse include all of the following except A. Violence against younger children. B. Sexualized behavior. C. Isolation. D. Stuttering. Think of the answer before the reveal. The answer is D. Stuttering. Flashcard 54. 4. The concept of gender roles is best defined as attitudes and behaviors attached to individuals because of their sex. B. An individual's sex orientation and / or preference. C. Biological characteristics that influence an individual's behavior. D. Interplay of biological and sociocultural influences. Think of the answer before the reveal. The answer is attitudes and behaviors attached to individuals because of their sex. Flashcard 55. 5. Which type of interviewing question is most likely to generate client defensiveness? A. Open-ended. B. Closed. C. Leading. D. Why? Think of the answer before the reveal. The answer is D. Why? Flashcard 56. 6. When interviewing a client whose speech patterns are different from the social worker's primary consideration should be that A. Communication patterns vary due to economic conditions. B. Speech is influenced by culture and experience. C. Psychosocial conditions will cause variations in speech. D. Speech is influenced by group taboos and norms and may indicate false beliefs. Think of the answer before the reveal. The answer is B. Speech is influenced by culture and experience. Flashcard 57. 7. The initial symptoms of schizophrenia most often occur between which of the following years of age? A. 6 to 12B, 13 to 16C, 17 to 45D, 16 to 60. Think of the answer before the reveal. The answer is C, 17 to 45. Flashcard 58. 8. Which of the following approaches would be most appropriate to use in evaluating client satisfaction with the social worker's provision of services? A. Using a single system design, evaluate the quality of services. B. In the final interview, ask the client about their level of satisfaction. C. After submitting process recordings, ask supervisor for feedback. D. At termination, ask clients to complete a service evaluation and satisfaction form. Think of the answer before the reveal. The answer is D. At termination, ask clients to complete a service evaluation and satisfaction form. Flashcard 59. 9. When conducting an assessment of the risk factors of child abuse for a child of a different ethnic background, a social worker must first be aware of how personal cultural biases affect the social worker's ability to deal with issues of diversity. B. Realize that assessment models are not a substitute for clinical judgment or experience. C. Use a strengths perspective rather than a deficit model to form a partnership with a child's family. D. Understand the need for appropriate eye contact, tone of voice, and question techniques during the assessment. Think of the answer before the reveal. The answer is A. Be aware of how personal cultural biases affect the social worker's ability to deal with issues of diversity. Flashcard 60. 10. A social worker is receiving a client with long-standing depression. It becomes known that the client has racist beliefs. The social worker should respectfully confront the client's prejudiced beliefs. B. Educate the client about the negative effects of racism. C. Refer the client to another therapist who might have similar belief. D. Respect the client's beliefs and focus on the presenting problem. Think of the answer before the reveal. The answer is D. Respect the client's beliefs and focus on the presenting problem. Flashcard 61. 1. The phase of the helping process which leads to subsequent implementation of intervention is exploration and summation. B. Exploration, assessment and planning. C. Initiation of established rapport. D. Clarification and analysis. Think of the answer before the reveal. The answer is B. Exploration, assessment and planning. Flashcard 62. 2. When reviewing a social worker's performance, the supervisor notes that the social worker conveys little empathy toward clients who have recently left welfare and holding first jobs. In order to help the social worker develop empathy with her clients, the supervisor should explain welfare work procedures from the client's perspective. B. Suggests the social worker enter therapy to become a more empathetic person. C. Model empathetic communication when engaging with the social worker. D. Clarify the agency's reason for supporting these clients. Think of the answer before the reveal. The answer is C. Model empathetic communication when engaging with the social worker. Flashcard 63. 3. The purpose of feedback in a social worker interview is to allow the social worker to confront distortions in the client's thinking. B. Summarize main points of the interview. C. Let the client know social worker understands the issue. D. Give the social worker opportunity to self-disclose for benefit of the client. Think of the answer before the reveal. The answer is C. Let the client know social worker understands the issue. Flashcard 64. 4. A social worker is leading a women's group with the purpose of improving personal and environmental circumstances. The social worker asks the members to identify the area in which they feel most competent. The social worker is following an intervention strategy best described as A. Reinforcement, B. Endorsement, C. Enhancement, D. Empowerment. Think of the answer before the reveal. The answer is D. Empowerment. Flashcard 65. 5. The best example of the educational component of supervision is A. Monitoring the caseload, B. Providing in-service training, C. Utilizing individual and group conferences, D. Refining knowledge and skills. Think of the answer before the reveal. The answer is D. Refining knowledge and skills. Flashcard 66. 6. In facilitating a hospital support group for bereaved parents, a social worker can discuss a personal experience of a death of a child to A. Create empathy with the participants, B. Receive help from the group, C. Create a sense of shared experience, D. Establish role as expert on grief issues. Think of the answer before the reveal. The answer is C. Create a sense of shared experience. Flashcard 67. 7. The primary role of a social worker is A. Building rapport, B. Providing support systems, C. Acting as a resource, D. Curing emotional or mental dysfunction. Think of the answer before the reveal. The answer is C. Acting as a resource. Flashcard 68. 8. A client with a history of drug abuse was referred to a social worker by a concerned relative. The social worker should first A. Conduct a family interview, B. Begin treatment, focusing on the reason for the drug abuse, C. Refer the client for substance abuse treatment, D. Evaluate the client's motivation for change. Think of the answer before the reveal. The answer is C. Refer the client for substance abuse treatment. Flashcard 69. 9. In adult survivors of childhood sexual abuse, the most frequently encountered defense mechanism is A. Denial, B. Intellectualism, C. Suppression, D. Projection. Think of the answer before the reveal. The answer is A. Denial. Flashcard 70. 10. Which of the following approaches would be most appropriate to use in evaluating client satisfaction with the social worker's provision of services? A. Using a single system design, evaluating the quality of services. B. In the final interview, ask the clients about their level of satisfaction. C. Through process recordings, ask the supervisor for feedback. D. At termination, ask clients to complete a services evaluation and satisfaction form. Think of the answer before the reveal. The answer is D. At termination, ask clients to complete a services evaluation and satisfaction form. Flashcard 71. Physiological, hunger, thirst, bodily comforts, etc. Think of the answer before the reveal. The answer is Maslow's first hierarchy of need. Flashcard 72. Safety and security. Out of danger. Think of the answer before the reveal. The answer is Maslow's second hierarchy of need. Flashcard 73. Belongingness and love. Affiliate with others, be accepted. Think of the answer before the reveal. The answer is Maslow's third hierarchy of need. Flashcard 74. Esteem. To achieve, be competent, gain approval and recognition. Think of the answer before the reveal. The answer is Maslow's fourth hierarchy of need. Flashcard 75. Birth to 12 months primary interaction through mouth rooting sucking is important, conflict is weaning. Think of the answer before the reveal. The answer is Freud's oral stage. Flashcard 76. 1 to 3 years old controlling bladder and bowels conflict in potty training, learn to control body needs, which leads to accomplishment and independence. Think of the answer before the reveal. The answer is Freud's anal stage. Flashcard 77. Discovering difference in boys' and girls' genitals. 3 to 6 years old conflict can be castration anxiety as mother's attention is sought. Think of the answer before the reveal. The answer is Freud's phallic stage. Flashcard 78. 6 years old to puberty libido interests suppress development of ego and superego can help calm these interests, exploration of peer relationships and social interactions. Think of the answer before the reveal. The answer is Freud's latent stage. Flashcard 79. Puberty to death stage, sexual interest of opposite sex, interest in welfare of others. Think of the answer before the reveal. The answer is Freud's genital stage. Flashcard 80. Birth to 1 year old trust comes from caregivers and quality of care. Trust happens and child feels safe and secure. Mistrust happens and child feels inconsistent, insecure, emotionally unavailable. Think of the answer before the reveal. The answer is Erickson's trust/mistrust stage. Flashcard 81. Early childhood focused on sense of personal control. Toilet training is vital for independence, control over food choices, food preferences, clothing, etc. Success leads to confidence. Think of the answer before the reveal. The answer is Erickson's autonomy/shame and doubt stage. Flashcard 82. Preschool years assert power and control over the world through directing play and social interactions. Success leads to child able to lead others and have a sense of purpose. Failure leads to guilt, self-doubt, and lack of initiative. Think of the answer before the reveal. The answer is Erickson's initiative/guilt stage. Flashcard 83. Early school age 5-11 through social interactions can develop sense of pride in their accomplishments and abilities. If encouraged and commended by parents/teachers, will feel competent and belief in skills. Think of the answer before the reveal. The answer is Erickson's industry/inferiority stage. Flashcard 84. Children explore independence and sense of self, receiving proper encouragement and reinforcement. With personal exploration, emerge with strong sense of self and feeling independent and control. Completing this stage leads to fidelity and ability to live by society's standards. Think of the answer before the reveal. The answer is Erickson's identity/confusion stage. Flashcard 85. Adulthood exploring personal relationships, develop close/vital relationships, which leads to committed, secure, strong sense of personal identity. Important to develop interpersonal relationships. Success leads to virtue of love, forming lasting relationships. Think of the answer before the reveal. The answer is Erickson's intimacy/isolation stage. Flashcard 86. Adulthood, career, and family feel like contributing to the world by being active in home/community. Develop care in this stage. Proud of your accomplishments. Unity with partner. Watching children grow up. Think of the answer before the reveal. The answer is Erickson's generativity/stagnation stage. Flashcard 87. Old age, reflecting back on life feels like life was wasted and regrets bitterness/despair. But if proud of life will feel integrity. Think of the answer before the reveal. The answer is Erickson's integrity/despair stage. Flashcard 88. Holistic approach to look at an individual's systems and how they interact with each other. Think of the answer before the reveal. The answer is General Systems Theory. Flashcard 89. Constant interaction with environment and each system impacts one another. Think of the answer before the reveal. The answer is Ecological Systems Theory. Flashcard 90. Family affects individual and family functioning across lifespan. Think of the answer before the reveal. The answer is Family Systems. Flashcard 91. A concept where a person has ability for a family member to tell difference between their experiences and identify themselves from others. Think of the answer before the reveal. The answer is Differentiation of self. Flashcard 92. When family identifications are fused. Think of the answer before the reveal. The answer is Undifferentiated family ego mass. Flashcard 93. When parents pull children closer to one side. Think of the answer before the reveal. The answer is Triangulation. Flashcard 94. Mutual emotional force within a family, which occurs when there is a chronic family tension. Think of the answer before the reveal. The answer is Nuclear family emotional process. Flashcard 95. Unhealthy way of dealing with family, growing up or building one's own individual identity. Think of the answer before the reveal. The answer is Emotional cutoff. Flashcard 96. People tend to have many similarities with those sharing birth order. Think of the answer before the reveal. The answer is Sibling position. Flashcard 97. Parents pour emotional problems onto child. Think of the answer before the reveal. The answer is Family projection process. Flashcard 98 family projection process repeats itself from each generation. Think of the answer before the reveal. The answer is multigenerational transmission process. Flashcard 99 theory that is concerned with how internal processes such as needs, desires, emotions motivate human beings. Think of the answer before the reveal. The answer is psychodynamic theory. Flashcard 100 theory that believes unconscious and conscious mental activity serves as motivating force in human beings. Think of the answer before the reveal. The answer is psychodynamic theory. Flashcard 101 theory that believes early childhood experiences are central in patterning an individual's emotions, which leads to problems in life. Think of the answer before the reveal. The answer is psychodynamic theory. Flashcard 102 theory that says individuals get overwhelmed with internal/external demands and use ego defense mechanisms. Think of the answer before the reveal. The answer is psychodynamic theory. Flashcard 103 believe healing occurs through attention to transferences and treatment relationships. Think of the answer before the reveal. The answer is psychodynamic theory. Flashcard 104 theories that support individuals' cognitive functioning and learn through acting on their environment. Think of the answer before the reveal. The answer is behavior theory/cognitive theory/learning theory. Flashcard 105 behaviors learned through conditioning, and we must help teach new skills and behaviors. Think of the answer before the reveal. The answer is behavior theory. Flashcard 106 theory focused on internal states such as motivation, problem-solving, decision-making, thinking, attention, and how we interact with the world. Think of the answer before the reveal. The answer is cognitive theory. Flashcard 107. Birth to 2 years old perception of world is limited to sensory and motor learn through sucking, grasping, listening need to learn object permanence. Think of the answer before the reveal. The answer is sensorimotor stage Piaget. Flashcard 108 believing something exists even when you cannot see it. Think of the answer before the reveal. The answer is object permanence. Flashcard 109. Age 2 to 7 language development, no concrete logic, not able to manipulate mental thoughts, not able to put themselves in other shoes, use symbols and role play. Think of the answer before the reveal. The answer is pre-operational stage Piaget. Flashcard 110. Age 7 to 11 think logically, have difficulty understanding abstract concepts, can reverse logics. Think of the answer before the reveal. The answer is concrete operational stage Piaget. Flashcard 111. Age 12 to adult think abstractly, logical thought, deductive reasoning, systematic planning, can understand hypothetical questions. Think of the answer before the reveal. The answer is formal operational stage Piaget. Flashcard 112. Success and failure is related to sense of contribution to a new environment. Think of the answer before the reveal. The answer is margin/matter community theory. Flashcard 113. 6 as in community development, introduction, interaction, involvement, influence, investment, identity. Think of the answer before the reveal. The answer is introduction, welcoming, orienting, teaching, interaction, sharing common experiences, involvement, everyone is important and needed, influence, investment, interaction is gentle and there is open, honest communication, identity, there is a we and us/unity and purpose. Flashcard 114. First stage of community building where everything is fine and everyone gets along to avoid conflict. Think of the answer before the reveal. The answer is pseudo-community. Flashcard 115. Second stage of community building where members vent frustration and disagreements and differences cannot be ignored. Think of the answer before the reveal. The answer is chaos. Flashcard 116. Third stage of community building where members embrace need of group and balance. Think of the answer before the reveal. The answer is emptiness. Flashcard 117. Fourth stage of community building where members have a true commitment and community and have empathy and understanding. Think of the answer before the reveal. The answer is authentic. Flashcard 118. First stage of group development where you become oriented to goals and procedures of the group. Info and structure are critical. Think of the answer before the reveal. The answer is forming. Flashcard 119. Second stage of group development where there's resistance and challenging of leadership. Think of the answer before the reveal. The answer is storming. Flashcard 120. Third stage of group development where there is cooperation and team building. Think of the answer before the reveal. The answer is norming. Flashcard 121. Fourth stage of group development where there is functioning to achieve group goals. Think of the answer before the reveal. The answer is performing. Flashcard 122. Fifth stage of group development where there is not functioning as group much longer and you work on closure. Think of the answer before the reveal. The answer is mourning. Flashcard 123. Understanding an individual and their behavior in light of environmental contexts in which they live and act. Think of the answer before the reveal. The answer is person and environment. Flashcard 124. Type of addiction model where addiction acts as a brain disease. There is neurotransmitter imbalance. The agent is the drug, the vector is the dealer, and the host is the addict. They stamp out disease by eliminating drugs. Think of the answer before the reveal. The answer is medical model. Flashcard 125. Type of addiction model that looks at drug abusers as self-medicating and that drug abuse is a symptom of underlying psychological problems. Drug is a maladaptive coping strategy. They need to resolve inner conflict, and then drugs won't be necessary. Think of the answer before the reveal. The answer is psychodynamic model. Flashcard 126. Type of addiction model where the drug use is a learned behavior and drugs are used because they were modeled. Use drugs due to peer pressure. Environment leads to drug use advertising. Drug use is a maladaptive relationship negotiation strategy. Think of the answer before the reveal. The answer is social model. Flashcard 127. Type of addiction model where addicts are weak and can overcome a compulsion to use with willpower. Drug abusers choose to use drugs. Drug abusers are antisocial and should be punished. Drugs are evil. Think of the answer before the reveal. The answer is moral model. Flashcard 128. Type of addiction model which says all other models are true to greater or lesser degrees. Each person's drug use is a result of some aspects of some or all other models. Treatment and recovery require addressing the body/mind/social environment and spiritual needs of an individual. Think of the answer before the reveal. The answer is biopsychosocial model. Flashcard 129. This theory identifies range of concepts to describe how people, groups, communities exchange information and how messages are conveyed and received. Think of the answer before the reveal. The answer is communication theory. Flashcard 130. Ability to communicate is central to effective social work practice and has many forms: language, speech, written word. Think of the answer before the reveal. The answer is communication theory. Flashcard 131. Nonverbal forms of communication. Think of the answer before the reveal. The answer is body language, dress, space tone, some which is unconscious. Flashcard 132. Way knowledge and skills can be adapted if they are to be made relevant and applicable to different situations encountered in social work practice. Think of the answer before the reveal. The answer is transferability. Flashcard 133. Person replaces one feeling or emotion in place of another. Think of the answer before the reveal. The answer is substitution. Flashcard 134. Refocusing of aggression or emotions evoked from an external force into oneself. Think of the answer before the reveal. The answer is inversion. Flashcard 135. Manifestation of emotional anxiety into physical symptoms. Think of the answer before the reveal. The answer is somatization. Flashcard 136. Separation of postponement of a feeling that normally would accompany a situation or thought. Think of the answer before the reveal. The answer is desiccation. Flashcard 137. Attributing a painful thought or idea to another person. Think of the answer before the reveal. The answer is projection. Flashcard 138. Attempting to provide a logical/rational explanation for something to avoid guilt or shame. Think of the answer before the reveal. The answer is rationalization. Flashcard 139. Form of denial in which object of attention is presented as all good, masking true negative feelings toward the other. Think of the answer before the reveal. The answer is idealization. Flashcard 140. Identifying with some idea or object so deeply that it becomes a part of that person. Think of the answer before the reveal. The answer is introjection. Flashcard 141. Losing of same aspect of development already achieved due to undue anxiety, causing a person to revert to a previously attained stage or lower level of adaptation. Think of the answer before the reveal. The answer is regression. Flashcard 142. Rationalizing and making generalizations about anxiety-provoking issues to minimize pain and anxiety. Think of the answer before the reveal. The answer is intellectualization. Flashcard 143. Using a negative or painful image, thought, or idea out of consciousness to avoid the associated pain. This is the primary defense mechanism. Think of the answer before the reveal. The answer is repression. Flashcard 144. Inability to simultaneously experience the cognitive and affective components of a situation. Think of the answer before the reveal. The answer is isolation. Flashcard 145. The unconscious modeling of oneself upon another person's behavior. Think of the answer before the reveal. The answer is identification. Flashcard 146. Shifting repressed feelings from where they originate to some other object. Think of the answer before the reveal. The answer is displacement. Flashcard 147. Repressing, dissociating, or disconnecting important feelings that are dangerous to psychic well-being. Causes person to get out of touch with her/his feelings and feeling to fragmented self. Think of the answer before the reveal. The answer is spitting. Flashcard 148. Refusing to acknowledge or recognize the reality and implications of painful, anxiety-provoking experiences. Think of the answer before the reveal. The answer is denial. Flashcard 149. What should an infant be doing at 4-6 weeks? Think of the answer before the reveal. The answer is smiling at parent. Flashcard 150. What should an infant be doing at 6-8 weeks? Think of the answer before the reveal. The answer is vocalize with various sounds. Flashcard 151. What should an infant be doing at 12-20 weeks? Think of the answer before the reveal. The answer is: show hand regard, recognize their hand, and follow it with their eyes. Flashcard 152. What should an infant be doing at 3 months? Think of the answer before the reveal. The answer is: hold up their head for a prolonged period of time, make foul noises, follow objects. Flashcard 153. What should an infant be doing at 5 months? Think of the answer before the reveal. The answer is: begin to enjoy vocal play, grasp objects, put objects in mouth. Flashcard 154. What should an infant be doing at 6 months? Think of the answer before the reveal. The answer is: saying multiple syllable sounds such as mama, dada. Sit up by themselves. Flashcard 155. What should an infant be doing at 10 months? Think of the answer before the reveal. The answer is: crawl, exhibit stranger shyness/anxiety. Flashcard 156. What should an infant be doing at 1 year old? Think of the answer before the reveal. The answer is: stand by holding on to supports, able to stand unsupported. Flashcard 157. What should an infant be doing at 18 months old? Think of the answer before the reveal. The answer is: walking without supervision/support. Flashcard 158. What should an infant be doing at 2 years old? Think of the answer before the reveal. The answer is: run or walk upstairs. Flashcard 159. Physical development. Age 1-4 months, head circumference should grow at a rate of about 1.5 inches for the first 2 months of life, and then at about an inch per month until an age of 4 months. Gums red. Think of the answer before the reveal. The answer is: brain is growing great for development. Flashcard 160. Physical development. 4 to 8 months child's head and chest circumference should be about equal. The head should continue to grow at a rate of about 3/4 inch per month until 6 months of age, and about 1/3 inch for each month thereafter. It is during this time period that the first evidence of teeth will begin to appear. Normally the incisors will come in first. It is this period that is associated with teething in our society. Think of the answer before the reveal. The answer is: on the motor skill development side, at this age the child should be able to pass an object from hand to hand and should be able to grasp a bottle. Flashcard 161. At 8-12 months, the child will have arms and hands that are more developed than the feet and legs, with the legs possibly appearing bowed and the feet appearing flat. Think of the answer before the reveal. The answer is: it is at this age that the child will begin to explore and has developed the ability to crawl and manipulate objects. Flashcard 162. At 12-24 months, the child is deemed a toddler. At this age, the rate of growth will slow, and the head growth rate will slow dramatically to about 1 inch every 6 months. Think of the answer before the reveal. The answer is: It is at this developmental stage that the chest circumference will grow larger than that of the head. Flashcard 163. As the toddler reaches 2 years of age, the posture of the child will grow more erect, and the brain will reach about 4/5 of its final size. The trend of slower growth will continue as the child continues to age at the stage of 3 years old. The head will continue to experience slow growth until about age 5, where the child's head will be almost as large as that of an adult. Think of the answer before the reveal. The answer is: throughout these years, the child's body will become more adult-like in proportion, and at age 5 should resemble that of an adult's, though on a smaller scale. Flashcard 164. At age 6, the child will begin to have their baby teeth start being replaced by their permanent teeth. Think of the answer before the reveal. The answer is: Flashcard 165. Secure base, where a child sees caregiver as secure base from which to explore the world. Protest caregiver departure. Seek proximity and comfort upon caregiver's return. Show preference for caregiver over a stranger. Think of the answer before the reveal. The answer is secure. Flashcard 166. Little response from child to separation or reunion. Due to child feeling there is not an attachment, no distress upon departure of caregiver, no response to return of caregiver, treats strangers equal to caregiver, parent doesn't respond to child when child is in distress, discourages crying behavior. Think of the answer before the reveal. The answer is avoidant. Flashcard 167. Child being unable to use a caregiver as secure base and has inability to explore. Child distressed upon separation, shows reluctance toward caregiver upon return, not able to be comforted by stranger. Parent has inconsistent response to child distress. Think of the answer before the reveal. The answer is ambivalent/resistant. Flashcard 168. Lack of coherent attachment strategy. Child showing freezing, rocking, similar excess upon return of caregiver, caregiver maltreatment, role confusion, abuse. Think of the answer before the reveal. The answer is disorganized. Flashcard 169. Birth to puberty, where childhood has 2 substages: archaic stage where there is sporadic consciousness, menarchic stage where beginning of logical and abstract thinking is ego starts to develop. Think of the answer before the reveal. The answer is childhood stage. Carl Jung. Flashcard 170. Puberty until 35-40. Maturing sexuality, growing consciousness, realization that carefree days of childhood are gone. Strive to gain independence, find a mate, raise family. Think of the answer before the reveal. The answer is youth stage. Carl Jung. Flashcard 171. Age 40 to 60. Realize you will not live forever, creates tension. Try to cling to youth. Fail in process of self-realization. Confront one's shadow. Religiosity may increase. Think of the answer before the reveal. The answer is middle life stage. Carl Jung. Flashcard 172. Age 60 and over. Consciousness is reduced. Jung thought death is ultimate goal of life. Won't face death with fear, but hope for rebirth. Think of the answer before the reveal. The answer is old age stage. Carl Jung. Flashcard 173. This isn't really happening to me? Or I am fine, there is nothing wrong, usually short-lived. Think of the answer before the reveal. The answer is denial, first stage of grief and dying. Flashcard 174. Who is to blame? Express envy and rage due to hidden feelings of resentment, jealousy, frustration towards others. People in this stage are held to care for and deal with. Think of the answer before the reveal. The answer is anger, second stage of grief and dying. Flashcard 175. Let's strike a deal. People in this stage are hoping to find a way to postpone death. Think of the answer before the reveal. The answer is bargaining, third stage of grief and dying. Flashcard 176. I am going to die. What's the point? Emotionally sensitive, uncomfortable, fearful, sense of tremendous loss. Don't try to cheer them up, let them go through emotions. Think of the answer before the reveal. The answer is depression, fourth stage of grief and dying. Flashcard 177. I can't fight it, may as well get ready for it. Stop fighting, death accepts fate. Think of the answer before the reveal. The answer is acceptance, final stage of grief and dying. Flashcard 178. Effects of stress, violence, and trauma. Think of the answer before the reveal. The answer is regression/halt of brain development, inability to identify, express, manage emotions, dissociation, mentally separate from experiences, difficulties self-regulating behaviors, difficulties thinking clearly, reasoning, problem solving. Flashcard 179. Normal aging changes. Eyesight loss, hearing loss, taste buds change, touch and small sensitivity, arteries stiffen, bladder problems, frequent urination, body fat shifts to surround deeper organs, bones lose minerals, brain lose some of the structures that connect nerve cells, kidney shrinks/less efficient, lung tissue loses elasticity, muscle mass declines, skin and nails grow slowly. Think of the answer before the reveal. The answer is Flashcard 180. A set of social and behavioral norms that are widely considered to be appropriate for individuals of a specific sex. Think of the answer before the reveal. The answer is gender role. Flashcard 181. Peacekeeper role, mediating and reducing tension between conflicting parents, maybe in response to unconscious anxiety about family breakdown. Think of the answer before the reveal. The answer is peacekeeper. Flashcard 182. A visible symptom of troubled family system. Think of the answer before the reveal. The answer is scapegoat. Flashcard 183. Head injuries, bruises, cuts, lacerations, internal injuries, burns, scald, reddening, blistering of tissues by any substance or force, injuries to body in any way, death. Think of the answer before the reveal. The answer is physical abuse. Flashcard 184. Rape, intercourse, sodomy, fondling, oral sex, incest, sexual penetration, sexual exploitation. Think of the answer before the reveal. The answer is sexual abuse. Flashcard 185 repeated negative acts or statements directed at child. Exposure to repeated violent, brutal, intimidating acts or statements among members of household. Cruel actions to attempt to gain submission, enforce maximum control, modify child's BX, rejection of child. Think of the answer before the reveal. The answer is emotional abuse and maltreatment. Flashcard 186 failure to provide and maintain adequate food, clothing, medical care, supervision, education. Think of the answer before the reveal. The answer is neglect. Flashcard 187. Chlorpromazine thorazine. Think of the answer before the reveal. The answer is schizophrenic drug. Flashcard 188 haloperidol haldol. Think of the answer before the reveal. The answer is schizophrenic drug. Flashcard 189. Perfenazine. Think of the answer before the reveal. The answer is schizophrenic drug. Flashcard 190. Flufenazine. Think of the answer before the reveal. The answer is schizophrenic drug. Flashcard 191. Clozapine clozaril. Think of the answer before the reveal. The answer is schizophrenic drug, but can really affect white blood cell counts. Flashcard 192 risperidone risperdal. Think of the answer before the reveal. The answer is schizophrenic drug, bipolar. Flashcard 193 olanzapine Zyprexa. Think of the answer before the reveal. The answer is schizophrenic drug, bipolar. Flashcard 194 quetiapine Seroquel. Think of the answer before the reveal. The answer is schizophrenic drug. Flashcard 195 ziprasidone geodin. Think of the answer before the reveal. The answer is schizophrenic drug, bipolar. Flashcard 196 aripiprazole Abilify. Think of the answer before the reveal. The answer is schizophrenic drug, bipolar. Flashcard 197 paliperidone and Bica. Think of the answer before the reveal. The answer is schizophrenic drug. Flashcard 198 lurasidone latuda. Think of the answer before the reveal. The answer is schizophrenic drug, bipolar. Flashcard 199 effects are major weight gain and change in metabolism, increased risk of diabetes and high cholesterol. Think of the answer before the reveal. The answer is atypical antipsychotic meds. Flashcard 200 fluoxetine Prozac. Think of the answer before the reveal. The answer is depression meds, bipolar. Flashcard 201 citalopram Celexa. Think of the answer before the reveal. The answer is depression meds. Flashcard 202 Sertraline Zoloft. Think of the answer before the reveal. The answer is depression meds, bipolar. Flashcard 203 Paroxetine Paxil. Think of the answer before the reveal. The answer is depression meds, bipolar. Flashcard 204 Escitalopram Lexapro. Think of the answer before the reveal. The answer is depression meds. Flashcard 205 Bupropion Wellbutrin. Think of the answer before the reveal. The answer is depression meds. Flashcard 206 Clozapine Chlorazil. Think of the answer before the reveal. The answer is bipolar meds. Flashcard 207 Clonazepam Clonopin. Think of the answer before the reveal. The answer is anxiety meds. Flashcard 208 Lorazepam Ativan. Think of the answer before the reveal. The answer is anxiety meds. Flashcard 209 Alprazolam Xanax. Think of the answer before the reveal. The answer is anxiety meds. Flashcard 210 Buspirone Buspar. Think of the answer before the reveal. The answer is anxiety meds. Flashcard 211 Methylphenidate Ritalin, Metadate, Concerta, Daytrana. Think of the answer before the reveal. The answer is ADHD meds. Flashcard 212 Amphetamine Adderall. Think of the answer before the reveal. The answer is ADHD meds. Flashcard 213 Dextroamphetamine Dexedrine, Dextrostat. Think of the answer before the reveal. The answer is ADHD meds.